Either myself or another provider has said, you need to have a hip replacement. Well, first of all, what I tell all my patients, I never say, hey, you need this done. However, if you're into my office, it's obvious that you've been having problems, and if conservative treatment has failed to provide relief for your hip pain, and there is destruction of the joint in general from hip arthritis, then hip replacement is the answer. Overall, the hip joint itself is a ball and socket joint, and it comes in two parts. You'll hear me talk about the cup or acetabulum. That's the socket. The socket is part of the pelvis. The thigh bone or femur, the top of which is the femoral head, that's the head ball. The cartilage around that wears out. That's what arthritis is of the hip joint. And so hip replacement is the answer by and large for most patients. And what does a hip replacement look like? This is a hip model. The acetabular socket side, this is the left half of the pelvis. What we do is we give you a new cup or a new socket. The new socket, the actual metal material, is made of titanium. It has a very porous surface. It's almost similar to like a metal type foam. Very porous, very sticky, very tacky. The whole design of that is that once we clean out the worn out cartilage and the arthritis from the hip, we put the new socket in and it fits in. There's a woodworking term called press fit. With time, because of that metal foam that's very sticky and porous, bone will actually grow into it. Additionally, if you notice that there are holes inside the cup. Those holes are there to allow us to put screws through the face, across the cup and into the bone. I call those insurance screws. They're extra fixation to ensure there's no movement of the cup to allow bone to grow into it solidly. The femur, what we do is we make a cut at the base of what's called the neck. That removes the ball or the femoral head where the worn out cartilage is. Now then what we do, we work from the inside out of the femur. The bone inside the femur is softer, and so we have instruments that allow us to work and fashion essentially a path. That path allows us to put a stem. This has a similar bony surface for ingrowth that's really porous. And when this impacts into place, we then attach the femoral head ball. This particular design has two independent heads that move. Not everyone gets this, it depends on other factors. And then that head ball meets into the socket. And this is how your new hip works.